Thank you for interviewing for clinical and counseling psychologist. How do you assess and diagnose clients with complex psychological conditions?
I think one of the most important aspects of assessing someone with a clinical psychological condition is getting a clear background in psychosocial history of their symptoms by connecting with their prior psychologist, psychiatrist, nurses, rehab therapists, and also family members and friends to see the duration of their symptoms. And then once you get an idea of their symptoms, then you can be able to diagnose a patient. I know there was a time in my clinical studies where there was a patient who was displaying several symptoms. However, she was undiagnosed. And it took a team of people to really have to monitor her symptoms. And um, she ended up being diagnosed with borderline personality disorder. What made it difficult to diagnose her was that she actually didn't have a lot of friends and family that were around her. And actually, there was outpatient research for her or outreach to her. So, clinical therapists were able to spend more time with her to see her symptoms and see her reactions to situations to diagnose her. And so, sometimes when it comes to clinically assessing someone and getting their history and diagnosing another person, it takes a team of people.
Can you provide an example of how you have collaborated with a multidisciplinary team in a counseling setting?
Yes. So, in a facility that I once worked for, the psychiatrist there actually did monthly assessments. So, they were required to do an assessment on their patients once a month. And within that month, that assessment included a medication evaluation and also a review of their symptoms, if they had any decrease and increase of symptoms, any social stressors that happened in that month of time, or anything that may be affecting them from the last visit to this visit. And to prepare for that, we actually do a note for the physician. So when the physician comes, they have like an overview of their sleep habits for the last month, their diet, medications. And so, working with the team, not only do we give that information to the psychiatrist, we give it to the nurses, we give it to the floor staff. That way, the whole interdisciplinary team is aware of the symptoms and how to further give them care for any future symptoms that they may have.
How do you approach situations where there may be conflict or disagreement with a colleague?
I approach situations with conflict by having a self-awareness within myself and staying calm in a conflict in which I see with two of my coworkers. And I allow myself to talk to each person individually to try to understand where the conflict is so that we can find a solution. There was a time where two of my coworkers, when we worked at the crisis center, they both responded to a crisis call, and both of them were in disagreement about how they both approached the consumer or the patient regarding safety. One coworker said the other coworker went into the house without assessing for safety, and the other coworker said they felt safe enough, and although they did an assessment, they just had a disagreement about the safety of approaching the consumer. And their emotion regulation got extremely high, and they weren't able to communicate with each other. And so, what I did in that situation was I separated them, allowed both of them to explain their feelings and what happened and how we can improve. And then we were able to come together and debrief about the crisis call so that moving forward, should the situation arise again, we're better prepared to handle the situation.
Tell me about the disorder you have the most experience treating. What are the results? Tell me about the effective treatment plan you have developed.
I would say the disorder that I have the most time treating is schizophrenia. About 95% of the patients that I see are diagnosed clinically with schizophrenia or schizoaffective behavior. And I've learned that with time, that early onset schizophrenia is sometimes in the early 20s, where you're going to develop either delusions, auditory or visual hallucinations, unclear thought process, even some type of catatonia, you'll develop those symptoms. And then there are times where the patient with schizophrenia will get prescribed an antipsychotic medication, and then with time, their symptoms decrease because the medication seems to be effective. And then that person with schizophrenia decides or sometimes feels that, hey, the medication not necessarily isn't working, but that they're better, so they don't need the medication, so they stop taking the medication and their symptoms decrease and they start to decompensate. So I've learned with treating schizophrenia that sometimes long-term injections, medications are more effective, and also increased psychotherapy and constant therapy is very effective in treating someone who has like a psychotic disorder. And then also communicating with all the people within the treatment plan, because someone with schizophrenia, their thought process is going to be unclear, and it's going to affect the way the schizophrenia is going to affect the way they behave, react, and they think. And so I think with schizophrenia, some of the most effective treatment plans are increased psychotherapy and medication treatment.
Can you explain your clinical counseling process before, during, and after a session with a client?
Yes. So the clinical counseling session and process before and after with the client, I definitely will want to speak to the client and also have them ask any questions that they have, so that they're comfortable, and also get a history, any background psychosocial history that can help me understand what's leading up to them today, and also ask them what they expect to get out of the therapy or the counseling session, so that there's a common goal and that the goals are met, and that the person can be more effective. There was a time once in a facility where a patient of mine was encouraged to go to group therapy, and she was going to group therapy, but when she would leave the group therapy, she felt more, I don't want to say aggressive, but she was definitely off her baseline behavior. And I do remember pulling her aside and having an individual talk session with her and asking her, hey, can you explain to me some of your struggles? I've noticed after these group sessions, you're feeling a little down and you're not so much yourself. And she said that in her group sessions, it kind of drains her a little bit because the people around her, she feels, aren't focusing on their goals like she is. So it made it really difficult for her to excel when the people around her aren't. And so I remember with that individual session with her, we were able to develop another treatment plan for her where she wasn't so focused on group therapy, but more individual therapy for her care.